I think right now we've already heard the bills that are out there right now probably aren't going to be going anywhere. They're going to have to. The speaker's already said, I think, that they're going to have to look at maybe scaling things back. But really, what they need to do is start all over, bring the Republicans in, and let's sit down at the table and work something out that'd be good for America and not just good for one party.
And I think that the fundamental basis upon which the Democrats have operated, of passing a health care bill in defiance of America's public opinion without the consent of the government, and one that operates on the principle that your health care needs are dependent upon the control of government and its cost to government, should be put in the ash bin of history. But it's a long way to go.
Well, it's already had a positive effect. The fact that they have basically said they're not going to move forward with the current bill, that's a huge victory. We need to scrap this current bill that's before Congress and start all over on a health care reform package that will ensure that we're protecting the doctor-patient relationship, controlling costs, but not having it be a government takeover.
But it is still frustrating that at a time that Americans are losing jobs, at a time of runaway federal spending and big government in Washington, D.C., Democrats still seem intent on putting together some kind of a government-run health care plan. We've urged Speaker Pelosi and the President to scrap the bill. We can work together over time to pass incremental reforms that will lower the cost of health insurance rather than grow the size of government. But we're going to have to be in that fight for a while because Congress and the White House yet don't seem to have the heart or the priorities of the American people right now in focus.
Yes, but if we can't start with lawsuit abuse reform, there's no reason to negotiate with Democrats. The bill's dead unless they find some way to make this toxic soup that they've created palatable to the American people, and they've already spit it out.
We should focus on health and wellness, new forms of insurance pooling opportunities for small businesses and families to bring down costs and provide competition, and do some public health expansions like with community health centers that keep people out of the emergency room. If you crafted a bill like that, you may have 80% agreement and we could do something really good for health care reform versus this overreach that Washington has currently been trying to do. But the Scott Brown election changes that equation, definitely.
Wow, wasn't that something? It has sent shockwaves through this Capitol. People are scurrying, they're thinking, holy smokes, if somebody in Massachusetts who's a strong Democrat could get beat by a Republican, we all need to be sensitive to that. But I know that even today there are leaders, Democratic leaders saying, well, we're not going to be able to do anything, health care is dead. It's not dead. And we need to stay ever vigilant that it does not get pushed through.
We know they were trying to jam it down our throats quite literally, almost. We've seen the Louisiana Purchase price where we see senators basically being bought off there in Nebraska. What this is showing that the most blue of blue states, and of all seats, that of Ted Kennedy, who was the leader to socialize and have the government take over our health care system,